Hello and welcome. I'm Dr. Amy, and today I'm starting a new series that I'm calling Vital Signs. This series is designed to cover lots of subjects that will make understanding any future or past ER visits much easier. So we're going to start with vital signs. What are the vital signs? Vital signs are considered temperature, heart rate, respiratory rate, blood pressure, oxygen saturation, and pain. So let's start with the first one. Temperature. What is a normal body temperature? Well, our normal body temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. Now, there's always a range with vital signs. So the range of normal temperature would be 97 to 99 degrees Fahrenheit. Now, there's many ways you can take a temperature: orally, tympanically, temporally, axillary, or rectally, which is in your bum. And a rectal temperature is the most accurate temperature. So if your doctor wants a very accurate temperature, you will get your temperature taken rectally. It's not such a bad thing. Next, heart rate. What is heart rate? Heart rate is how many times your heart beats every minute. So normal range of heart rate is 60 to 100 beats per minute. Now, normal. This is a question we get asked a lot as nurses, is what is normal? Okay, so especially for heart rate and blood pressure, normal is whatever is normal for you. Now, the specified range of normal for heart rate is 60 to 100 beats per minute. But for example, my resting heart rate is less than 50. That is not within the normal range, but that is normal for me. So it's important to remember that when you ask that question, the nurse might ask you, what is normal for you? So how can you check your heart rate? That's a great question. So 2 fingers, carotid artery right here. You can feel that pulsating with your fingers. Count the beats per 1 minute. Or you can also do it radially. So radially, thumb side of your wrist, 2 fingers, feel around until you feel that boom, boom, boom. Count it for 1 minute. That's right. And that is your normal heart rate. Now, heart rate changes throughout the day depending on what you're doing, right? You're exercising, your heart rate's going to go up. You're resting, your heart rate's going to go down. Another thing that we take into consideration with heart rate is it regular or irregular? Regular, of course, means boom, 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 just like music, or boom, 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 boom. Has no rhythm, it's random, it's irregular. If it's irregular, you may have some type of arrhythmia. Now, we also look at the quality of your pulse, okay? Quality of your pulse, let's just generalize. Is it strong or is it weak? This also tells us something about your blood pressure. If your pulse is strong, you've got a good blood pressure. If it's weak, you might have a low blood pressure. Okay, next, respiratory rate. Respiratory rate is how many times you breathe in and out, that's 1 cycle, every minute. So count your breaths basically for 1 minute. The normal range for respiratory rate is 12 to 20 breaths per minute. So another thing that the nurses and doctors do is we listen to the quality of your breathing with a stethoscope, right? So the doctor puts a stethoscope on your back in different areas, right? And has you take a breath in and a breath out. We listen for the sounds. If it's clear, that's good. If we hear noises in there, could be tightening of the bronchioles, which is wheezing, or there could be fluid in there or mucus, and that would be more of like a rattling or a crackling sound. Next, blood pressure. I'm going to give you a range. Normal is anywhere from 90 over 60 to 120 over 80. Now, let me explain what those numbers mean, because I find that people don't understand what that means. And so there are always lots of questions about blood pressure and what is normal. Again, what is normal for you? That's very important to know when you go into the ER, is what is normal for you. Is it normally high? Is it normally low? A lot of people don't know. So let's explain what those two numbers are. So the top number is called a systolic blood pressure. The bottom number is called a diastolic blood pressure. So let me explain what those two numbers mean. So the top number, the systolic blood pressure, is the amount of pressure in your arteries when your heart beats, right? So think of your arteries, the whole system, as a system of pipes, right? We have arteries, we have veins. Arteries are what take the blood away from our heart out into our extremities, and the veins are the vessels that bring our deoxygenated blood back to our heart and lungs to get oxygen, okay? Arteries are the ones you can feel the pulses, okay? Veins, you can't feel the pulse in veins, all right? So systolic blood pressure, how much pressure is in that system, the arterial system, when your heart beats, okay? The bottom number, the diastolic number, is the amount of pressure in those same vessels when your heart is resting between beats. So we can have an entirely different show about blood pressure. There's a lot of things that you need to know about blood pressure, but today, let's say that if you're consistently have blood pressures greater than 120 over 80, you need to see a doctor, especially if you have symptoms like dizziness or headaches. Okay, moving on. Oxygen saturation. Oxygen saturation is that measurement we get by putting that little red laser light on your finger. It's painless, but sometimes it'll be a sticker, sometimes it'll be a little clip. So the machine can read with that little laser how saturated with oxygen your red blood cells are. The normal range of oxygen saturation is 92 to 100%. Okay, the last vital sign, pain. Nurses always ask you to rate your pain. So what that means is, how severe is it? 0, of course, is none. And the scale goes up to 10. 10 is the worst pain. Patients like to say, it's a 20, it's 100. Sorry, guys, we get it. You're in a lot of pain, but it only goes up to 10. We're also going to ask you about the quality of your pain. That means, what does it feel like? Is it stabbing and sharp? Is it dull? Is it achy? Is it crampy? Now, all of these vital signs put together can tell us a lot about your general well-being. And we'll get into more of the specifics on future episodes. I hope you enjoyed Short and Sweet Vital Signs.